In Chapter 11, we're going to talk about lymphatic system disorders. I want you to read over pages 211 through 214 of your book. Know that the basic structures of the lymphatic system are the lymphatic vessels and the lymphoid tissues, which includes the tonsils, lymph nodes, spleen, and the thymus gland, and have a basic understanding of what these structures do, and then take note of the lymphatic circulation. So we have a few lymphatic disorders to talk about. First, we're going to talk about lymphomas. These are malignant neoplasms, so these are cancerous tumors that involve lymphocyte proliferation, which means like the rapid increase in the numbers in the lymph nodes. So we don't know the cause of lymphoma, but here there is a higher risk for adults that have received radiation when they were kids. And there's two main types, Hodgkin's and non-Hodgkin's. Hodgkin's lymphoma initially involves a single lymph node, usually in the neck, and then the cancer spreads to the adjacent lymph nodes and then goes into the organs via the lymphatic system. The T lymphocyte is defective and the lymphocyte count is decreased, and then you'll see the Reed-Sternberg cells, and these are giant cells present in the lymph node that are used to diagnose Hodgkin's lymphoma, and we see that like in a biopsy. So some symptoms are going to be a painless enlarged lymph node, and then later you'll see splenomegaly and enlarged lymph nodes throughout the body. General signs of cancer as well, like weight loss, anemia, low-grade fever, night sweats, fatigue. We treat this with radiation, chemotherapy, and surgery. Non-Hodgkin's lymphoma can be caused by HIV infection, but it is not always caused by HIV. It's similar to Hodgkin's lymphoma in the signs and symptoms and treatments, but in non-Hodgkin's lymphoma, there's multiple lymph node involvement scattered throughout the body in a non-organized pattern versus in Hodgkin's where it starts with one lymph node and spreads to the adjacent lymph nodes in a pattern. Because of this, it is more difficult to treat. And then we have multiple myeloma, which is a neoplastic disease of unknown etiology that occurs in older adults. It involves an increased production of plasma cells in the bone marrow, eroding the bone. The production of the blood cells is impaired, and multiple tumors destroy the bone that can destroy the bone are developed. And the prognosis is poor, and there is a short life expectancy for people that have this. So the onset is usually insidious, which is slow with very few symptoms, if any. So it's usually very advanced by the time it is diagnosed. It's painful due to the deterioration of bone. And anemia and bleeding are common because the blood cell production is affected. Kidney function is affected and eventually kidney failure develops. And chemotherapy is used to help put the patient in remission, but the average survival is only 3 years once they're diagnosed with this. And then last we have lymphedema. Lymphedema is when tissues in the extremities swell due to an obstruction of the lymphatic vessels and accumulation of lymph. It's most commonly congenital, and we treat lymphedema with diuretics to reduce the swelling, strict bed rest, and massaging and elevating the affected extremity.